to do a dry needling technique for the suboccipitals. Now, a lot of therapists get very nervous in the area of the suboccipitals, and for good reason. There's some neurovascular structures we need to be aware of. It's an area where we can get a little bit sort of hesitant if we're not familiar with the anatomy, and that's what we're going to try to do here, get familiar with the anatomy. So if we find that central point on the base of the skull, come lateral out from there, and that puts us onto the muscle belly and the tendon of semispinalis. Roll laterally off of that, and we tend to find this little hollow spot where there's no obvious muscle tendon, or muscle or tendon I should say. Go lateral to that, and it puts us on the back of the mastoid process. So we're going to use the back of the mastoid process and the semispinalis muscle as our two anatomical landmarks. If we then come between those two, we find that hollow spot that I mentioned before. Rolling just off the base of the occiput into that hollow spot, that gives us our insertion point, our access point that we can access that suboccipital group from most effectively and safely. So we're going to insert the needle there. We're going to direct it medially, superiorly, and slightly anteriorly across, almost like we're trying to reach the needle towards the back of the opposite eye. So on the left side, reaching to the right eye. Okay. So from here, we're going to take the alcohol swab, clean that area. If there's hair growing over that area, there's really very little need to swab it, but if there isn't, then it's always a good practice. I'm going to then use a 30mm needle, because that's plenty of needle for me to access the depth that I need to get down to that oblique capitis inferior muscle. And that's the particular suboccipital that we can access most effectively and safely through this technique. So again, rechecking my anatomical landmarks, we find the base of the occiput, we find the semispinalis muscle, we find the back of the mastoid process. So that gives us 3 points of reference. Drop under the occiput into that hollow spot, pointing the needle across, like I said before, towards the back of the opposite eye. So from there, I'm going to tap that needle in, feed the needle through the top layer of skin, which can sometimes be a little sensitive and quite thick to get through. Once you get past that, the tissue is pretty easy and soft, so we can usually glide the needle quite simply and safely and effectively through that. If the needle's sliding through the tissue very easily, there's a very good chance you haven't hit that suboccipital belly yet. When you do hit it, it feels a little bit rubbery and thick, so that's the sensation we're looking for. We want to get through to that thicker part of the tissue, and you want to pass through that top layer into that muscle. The client will then sometimes complain of that dull, deep, aching pain at the top of the neck, sometimes referring out over the top of the head like we would get with a trigger point from the suboccipitals. So inserting into there, typically with a 30mm needle you're going to use about 2/3 of that, so about 20mm will usually get you pretty close to the suboccipital muscle in most average size necks. Find that trigger point, we can then leave that there for 10 minutes or so to let it settle down, or if it's quite active and it settles quickly, then you can come back and re-stimulate with the needle in various different ways, however you would choose to do it with your particular needling style. Okay, so again, once again the approach is splenius capitis, mastoid process, base of the occiput. There's our 3 points of reference. Drop the needle into the hollow spot between those, angling across towards the posterior surface of the opposite eye, and that gets you to the oblique capitis inferior muscle belly. Give that a try.